Are planks good for pelvic floor dysfunction? That's the subject of this video. Hi, I'm Dr. Shakib. I treat pelvic floor dysfunction due to pelvic instability or biomechanics. In this video, I'll be talking about what pelvic floor dysfunction is, if planks can affect the pelvic floor. We're going to understand and go over some of the modifications that need to take place and some of the exercises that I really like for pelvic floor dysfunction. So let's begin with the first question: what is pelvic floor dysfunction? Pelvic floor dysfunction is essentially any issues related to the pelvis and its instability. Most often they show up as a result of muscles inside of your pelvis becoming too tight. The question is, why do they get tight to begin with? The muscles inside of your pelvis work with the muscles outside of your pelvis to stabilize the pelvis. Why is that so important? Your pelvis is the foundation to the structure above, and if the foundation is weak, the structures above are not going to be functioning properly. Now, remember, without your arms and your legs, you are simply disabled, but without your trunk, you cannot live. So pelvic stability becomes extremely important. Pelvic floor dysfunction it comes in many shapes and forms. If it was a name of a book, it would have many chapters. In today's society, it seems like it's mostly related to urinary or bladder performance, intestinal performance, and sexual performance, when in reality, there are so many different versions of pelvic instability that exist that we are not identifying, we're not treating effectively, and therefore they show up later on with different presentations. So if you have chronic lower back pain, chronic sacroiliac joint pain, chronic hip pain or mobility issues, if you have poor posture, if you have issues with starting or finishing your urination, or even sexual performance, if you have tailbone pain, all of those are different presentations of pelvic floor dysfunction. The next question is, how planks affect the pelvic floor? When you do planks correctly, functionally, you are to keep your trunk in a very stable fashion. So that means your trunk is stabilizing itself, your arms are performing the arms job, your legs are performing the legs job. You are breathing biologically. Many times people do planks, but a lot of these things that I mentioned are not in place. So what's holding them up is not a nice equal distribution of the task with the front of the body, back of the body, and the side of the body. And what is holding the person up is not necessarily the right body parts. This is when we end up using parts of our body, including clenching of the butt or perineum, to hold ourselves up. This is not holding the lower part of your body when you're doing the plank, is not the task of your butt clenching or your perineum. A lot of times people are holding their breath or they are not breathing effectively. That alters the state of tonicity of the muscles in the inside. And so if this becomes your way of doing the plank exercise over time, it will create pelvic floor dysfunction. So what are some of the things that we do? Let's talk biological breathing. What does that mean? That means you're going to be breathing in and out through your nose. You're breathing in, your lungs fill up. When your lungs fill up, this dome-shaped diaphragm gets pushed down towards the muscles inside of your pelvis right here. So as these muscles are, I'm just putting it here so you get to see, As that pressure goes down, that inner abdominal pressure reaches this area when the pelvis is nice and stable. So you can't be in a slouch position trying to do biological breathing. You need to be upright, sitting on your sit bone with your neck glided back, your shoulder blades nice and even. You're not sticking your chest out. You're just sitting there with your shoulder blades not rolled forward, but right flat on your back. So now you're breathing in through your nose. Consider this dome-shaped diaphragm is moving down and pushing your sides out. When it pushes your sides out, concentrate on the outward position before you push your tummy out towards the camera in this case. Most often, people are so busy doing their tummy breathing that they're pushing their tummy outward and not enough is getting to the outside. Concentrate on seeing this dome-shaped diaphragm being pushed outward and you feel the sides going out. When that happens, you don't direct that force directly down as if you're bearing down, like you're forcing to pee or forcing to poop. If you have to do that, you're doing it incorrectly. So place your hands, the fingers in the front and the thumb on the back part of your back. As you're breathing in, you're breathing through your nose, pushing your sides out, and then breathing back out through the nose. This is a practice that takes a long time to do it correctly. It's best to start doing it with you on the floor. So you're laying down on your back. I'm just going to go ahead and lay down on my back with the small of your back closed. Place your hands in the areas I just showed you, elongated neck, having the muscles, the knees outward, closing this gap in the lower back by using the muscles in the front to pull it up, placing your fingers there. Breathe in and push the sides out. So I'm going to go ahead and not talk and do this. When you are concentrating on pushing the sides out, you cannot push down like you're forcing the pee or poop. And that is how the muscles inside the pelvis have an opportunity to relax. So if this was the muscles inside the pelvis and I'm showing it to the camera, look at where my fingers meet. When you're breathing in, they relax those muscles. The pressure from inner abdominal pressure relaxes those muscles a little bit. It's the inside muscles, the same muscles contracting together and symmetrically, uniformly, that initiate the breathing out process. This is what biological breathing is. This is what we have learned by studying human babies, and we see that every baby breathes this way. Believe it or not, modified plank is a great beginning exercise. So I'm going to show you how that is done. So modified plank is something we all did from the age of 3 to 6 months when we were just I guess technically that's not even a toddler. So when we were between the ages of 3 to 6 months. So it starts like this. You lay down with your fingers under your shoulders and your elbows are not glued to your side and they're not sticking out. They're just simply resting and pointing towards the back wall, and you are pressing into the ground with this bone on the outside of your wrist on the pinky side. So find that bone, place it on the floor as if you're trying to push into the ground from your elbow to that pisiform. You're on your forehead and you scrape your nose to get the tip off about an inch. Then you glide your neck up, and as you're gliding your neck up, you're sending the top of your shoulders to your elbows, and from your elbows to the pisiform. You're breathing biologically and you lift yourself up. When you're breathing biologically, you're pushing your sides out. Your knees to the top of your ankles are on the ground, and everything is doing its job correctly. What you want to make sure that you do is you're not dipping down and you're not going up. You're not holding yourself up, doing your mid back, or lifting yourself up from this position with your upper trap. So pisiform pushing into the ground, lifting you up, and you stay there. This is what you did between the ages of 3 to 6 months, and the exact mechanics were in place. Every part of your body did its job, and you definitely do not clench your butt, and you do not try to engage your perineum to get you up. The problem comes when we are not there, but we're so anxious to be there that we push ourselves, jeopardizing the form. A failure in the form is the reason why we end up doing things dysfunctionally. I hope that this video helped you. Please make sure that you comment and you subscribe to the channel, you comment below, and make sure you turn that notification bell on so next time I post a video, you get notified. Thanks for watching.